We've had some fantastic talks about that, so I don't need to cover any of it. What we are going to be talking about, though, is the human-companion-animal bond, and more importantly, how we can utilise it to perhaps convince people, as Adrian said, about the positive aspects of dogs. I don't need to tell you about the bond, you all get it, otherwise you wouldn't be here. Now certainly, although I'm focusing on dogs this afternoon, you can apply a lot of what I'm saying to cats. There are going to be cats and other species. There are a few changes, but primarily the whole point of pet ownership is the positive things that they bring to us and society. What we're aiming to do with the pet prescription, and you do have a copy of this in your packs when you pick them up later on, is really to educate people about the positive aspects of dogs, what they bring to us both as owners and even if we interact with them. On the basis of that, what we want to do is to try and, certainly for us in the UK, is to reduce abandonment, try and keep pets in their homes rather than them coming to us as rehoming centres. And ultimately, we heard from Ray earlier on about the One Health aspect, the things that they can bring to us as humans from a health perspective. And if we're talking about One Health, how we ought to be interacting with health departments, and again, how we can utilise this information to perhaps change people's perception of dogs. So for us in the UK, why do people relinquish animals? All sorts of reasons. If we look up here, it's very easy to blame the dog for allergies. It's a line of least resistance. Behavioural issues, we've certainly heard from Steve, from Carolyn, from Sarah over these past couple of days, how quickly we can achieve results by putting good techniques into practice. But we need to keep reinforcing them. Those techniques don't just work on a 5-minute interaction with the dog. We've got to keep reinforcing it. For me as a vet, if I diagnose a problem, as I do, say a dog's got an infection, I give the owner some antibiotics, the dog takes the tablets, generally it gets better. So it's low impact for the owner, but with behavioural issues, it takes constant reinforcement. It means that we've got to keep working at it. It's like bringing up children. You can't just tell them once and leave them to get on with it. But it's so much easier just to pass the dog off. Sadly, we do live in a society where it's easy to throw things away. I was at one of our centres just last week, and a young couple had bought a cockapoo puppy, so these are designer crossbreed between a Cocker Spaniel and a Poodle. Paid £650 for it, so about €700. Within a week it was in one of our centres because they couldn't cope with it. Partly I suspect they didn't realise what was involved in looking after that puppy, but equally it's the line of least resistance. It goes into this is too difficult to deal with category, so let's just pass it on, move on to something else. Now certainly for many of you, it's not so much about abandonment, but the issues that you face are street dogs, as Ray's already spoken about this morning. Dogs on the streets, they could be true strays, they could be owned dogs that have wandered, but equally they could be community dogs as well. Sadly for a lot of municipalities, they're viewed as a nuisance. We need to kill them, we need to get rid of them. But that's not even a quick fix. Long term, it doesn't work. So what I'm hoping with the information that I give you today is that you can utilise that information to talk to the people that you need to talk to in their currency. I will certainly be sharing with you how we're using the information in the UK in terms of pet ownership and abandonment, but I think a lot of it goes across the board. We can tweak it to our particular need. So in terms of dogs and people, like I say, I'm not going to spend ages talking to you about the human-companion-animal bond, but I think it's probably useful just to review how we do live and work with animals and how that bond becomes stronger and stronger the more we do with them. For years, we've harnessed the abilities of dogs to work with us, so things like herding sheep. Detection dogs at airports, and the personal experience of this, myself and Laura coming out of Gatwick on Monday, we ended up in a line-up for an explosive detection dog to see if we were carrying explosives. Thankfully we got through. I'm not sure if it would have been the case if Carolyn walked through with all her liver cake in her bag, but fortuitously they didn't pull her up. But again, it's all to protect us. Search and rescue dogs, again, play a vital part. We all remember 9/11 and the vital part that dogs played in that. Mountain rescue, again, they're there to help us. Taking this a little bit more personal and more recent, we also have cancer dogs now, these so-called biodetection dogs. What these dogs do is they're able to detect cancer in urine samples so they can actually pick up prostate cancer in them. I certainly came across one story again. We always hear stories about dogs going above and beyond the call of duty. A particular dog was checking a series of urine samples and kept going back to the same sample, indicating it. But the medics that were dealing with the patient already knew that that particular individual did not have prostate cancer. This dog kept going back, so they actually got the person involved back into the hospital, did some further investigation, and it transpired that that particular individual actually had cancer of his kidneys. So the abilities of dogs are phenomenal. If we move a little bit closer even still to assistance dogs, again, they provide such a fantastic service. We again know of the abilities of assistance dogs. But for the people that are partnered with the assistance dogs, it's not a working relationship. And the social support that these people get from their dog is just as important as the freedom that they are given because they have their assistance dog with them. So if we start looking at the dog prescription itself, as I've said, for us at Dogs Trust, what we want to do is to utilise it for advice, to make people realise and appreciate the importance of dogs and what they can do with us, so that we can promote a better relationship for them. I think for a lot of you dealing with municipalities, where you're having real issues with their view of dogs and that they're a nuisance, I think using this information and just extrapolating from it in terms of benefits, hopefully it will give you some new arguments to put towards them. So what I've very much done with this, I've changed the order a little bit, and I've looked at it from a cynic's point of view, which my colleagues will appreciate because they always call me Dr. No. But what's in it for me? And the questions I want to answer is what's in it for me as an individual, but also what's in it for me as a municipality? How can I use this information? So the first one, dog owners make fewer visits to their GP and spend less time in hospital. It's not about being out walking the dog, it's actually just about being in the vicinity of a dog, having a dog with us. So for me as a person, as a dog owner, if I have a dog, I've got 16% less chance of going to my doctor over the course of a year. I spend over 20% less time in hospital. None of us want to spend time in hospital, they're full of sick people. So I know that I'm going to feel healthier if I have a dog. For me as an individual, that means I'm going to feel healthier. If I have to pay for my healthcare, it means I'm going to be spending less time on my healthcare. And it also means I'm probably going to be off work less, and therefore I don't lose any pay. From a municipality point of view, if I'm not visiting my doctor as often, if we provide a national health service, then there is less drain and strain on the national health service. I'm not costing as much. And equally, from an economic point of view, if I'm at work more, I'm contributing more to the economy, I'm paying my taxes. So automatically, we've gone beyond this is a dog, this is a problem, to actually, we've moved on to healthcare and we've moved on to economics, which certainly in these times of austerity I think are really quite important. Dog owning adults and children are more physically active and healthier than non-dog owners. Dog owners, on average in the UK, spend 44 minutes a week more actively out walking. May not sound very much, but that actually adds up to over 38 hours over the course of the year. And that's actually quite a lot of McDonald's, or chocolate, or beer, or whatever your particular currency is. So it means if I'm exercising more, one, I can enjoy myself more, But it means that, I'm going to be healthier. I can maintain my body weight. Now, clearly that depends on how you actually exercise the dog. But in general, I'm going to be a healthier person. It also means that I'm not going to be so prone to things like obesity, and more importantly, the effects of obesity. Things like type 2 diabetes, we know it's on the rise. We know obesity in general in our population is on the rise. It also means, Maggie mentioned earlier on, that old age isn't a problem. It's the things that go with old age that are the problem. And therefore, as I get older, my knees, my hips may start to wear out. If I'm carrying more weight, they're probably going to wear out a lot more quickly. So lots of benefits for me as an individual. Again, from an authority point of view, if I'm more physically active, because I've got less chance of getting these diseases, then again, I'm going to put less strain on the health service. For me as an individual, it means it's going to cost me less if I'm having to pay for it. And again, there's less chance of me having time off work through ill health because I'm unhealthy. Owning a dog can help lower blood pressure in children and adults, and certainly with people with borderline hypertension, so people with borderline clinically high blood pressure, it can actually make quite a difference. So what does that mean? Well, it means for me, as an individual, that I've got less chance of getting disease associated with high blood pressure. So, for example, things like stroke. I'm minimising my chances of getting it. In terms of humans, it takes less than 30 minutes for humans for our blood pressure to go down if we're in the company of the dog. And we also know that dog-owning humans actually cope with stressful situations much better than non-dog owning humans. So again, if I have a challenging situation in my life, I'm much more likely to be able to cope without any external help. So again, from a local authority point of view, it means that, again, I'm going to be healthier, I'm less likely to have things like stroke, which is going to take chronic medical care. It's going to take me out of work for a long time, which means, again, I'm not contributing to the economy. So you can see there's a common theme here. It's not just about the dog, it's not just about me, but it's how I contribute to society. As if everything, it's not 100%. This is Ellie. How do dogs always know when we're about to go out? Ellie decided that she wanted to check out our local village pond. So whilst they do generally lower our blood pressure, I don't think she did at that particular point. But I'm pleased to know that she's still a very sprightly 11-year-old, despite her little trip into our village pond a few years ago. Dog ownership aids recovery of post-coronary patients. As a dog owner, I've got less chance of having heart disease. If I do have coronary surgery, I've got a much better chance of recovering from it. The success rate, the difference is 84% if I don't own a dog, 94% if I do. If I have a heart attack and I'm a dog owner, I'm nearly 9 times more likely to still be around in a year's time. That's quite significant, 9 times. So again, from what's in it for me, I'm probably going to recover better, which means I'm probably going to recover a little bit quicker. I can get home, reduce my medical costs, get back to work, get back to a normal life. From a local authority point of view, it means again, I'm not drawing so much on health services, I can get back to work, I can start contributing to the economy again. So again, huge benefits there. Dogs can provide great emotional support for humans during periods of stress and anxiety. We have a stress hormone in our body called cortisol. I'm sure you're all familiar with it. Mine's up here somewhere at the moment, standing in front of 200 people. But this is short term. I know by the time I get back to the hotel, have a glass of wine in front of me, back down to normal. And no matter what we do and who we are, we all go through major changes in our lives when our stress levels are going to be high. Be it loss of a loved one, relationship breakdown, divorce, money worries, employment worries, they're all going to push our stress levels up. And whilst a little bit of stress is good, long-term high levels of stress are not good for us. Again, they're going to lead on to health problems, high blood pressure, risk of stroke, and all the associated things with that. The simple presence of a dog can actually reduce our stress levels. And in fact, the presence of a dog has the same positive effect on reducing our stress as the presence of a good friend. So whilst it's lovely to have our friends around us, again, with our dog, it's unconditional and we know that they're going to lower our blood pressure. I think when we're dealing with periods of stress and anxiety for humans, it's important we don't forget the children. I am going to come on to children in a moment, but I think particularly for things like relationship breakups, quite often mum and dad are so busy fighting between themselves, they forget about the children. Certainly at Dogs Trust, we recognise this, and probably one of the biggest stresses, I think, is if that particular relationship is violent. We know that victims of domestic violence will delay fleeing the violent situation because they don't want to leave the family pet behind. But equally, if we look at it from the child's point of view, the dog, the family dog, may be the only stable point in their life. So what we offer is fostering for dogs of victims of domestic violence so they can get out of that situation. And then once they're in a position where they're more settled, then we can return the dog to them because we appreciate, we understand, and I'm sure you will understand as well, how important it is to maintain that stability for the child in the family. So with the emotional support, for me as an individual, it means I'm much more likely to be able to cope with stressful periods in my life without taking time off work, without relying on external help. And again, from a local authority point of view, I'm much more likely not to take time off work, therefore I'm going to keep contributing to society. Dogs can reduce depression and improve mental well-being in humans. Sadly, mental health in humans is still quite a taboo subject. It's not like a broken leg or a cut. You can't see it. And we still find that even our peers and even some members of the medical profession have different views towards mental health. We're very good in the UK of having that stiff upper lip, and saying, oh, well, just pull yourself together. But sometimes that's actually not enough. And again, we know with the presence of dogs that individuals that are suffering with depression, they have increased self-esteem, lower feelings of loneliness, lower feelings of isolation, and their depression level scores go up, as in a positive manner rather than negative. So again, huge benefits just by having an animal around. For me as an individual, again, it means that hopefully, if I am depressed, it's going to help me recover much more quickly. In terms of cost, it's going to keep the cost down. It hopefully means that I can get back to work fairly quickly. So again, from a local authority point of view, reducing the draw on health services and health provision, and making sure that I contribute to society as well. Just to give you an example, in the UK, over 400,000 people a year are signed off work with stress, anxiety and depression, which equates to over 13 million working days each year. That's 13 million working days lost. And if we could have even just a small effect on that, that could have a huge benefit on our economy. Not least to say on the people that are involved. Sadly, ageing is inevitable. We're all going to get old at some stage. We're living longer. Many of us have elderly relatives. And certainly a lot of us, I think, probably get into that situation where the parent-child relationship with our parents suddenly starts to turn the tables because our parents start to become more dependent on us. As we get older, a lot of people lose their life partners. Their family may have moved away from the area. And therefore, feelings of loneliness and isolation can be very, very high. But actually having a dog can help that significantly. And even, I'm not going to speak terribly much about visiting dogs, pat dogs and such like, but animals visiting elderly people in nursing homes just for 30 minutes, 3 times a week, again, it can have a significant effect on their feelings of loneliness. Boris Levinson is certainly seen as the founding father of the human companion-animal bond. And certainly he looked upon the dogs that he worked with as his co-therapists. I'm going to read this to you. Many elderly and lonely people have discovered that pets satisfy vital emotional needs. They can hang on to the world of reality, of cares, of human toil and sacrifice, and of intense emotional relationships by caring for an animal. The concepts of themselves as worthwhile persons can be restored, even enhanced, by the assurance that the pets they care for them love them in return. Again, it's unconditional. And this is quite some time ago now, but he recognised, and in fact, interestingly, even Florence Nightingale was known to have quoted how important and the beneficial effect that animals had on her patients. And so we're talking back in the 1800s there. So health benefits for older people, better scores relating to activities of daily living. We are creatures of habit. We like routine, we live by routine. I think that's one of the big challenges that people face when they go into retirement, that they've spent the past 40, 50 years getting up, going to work, and having quite a distinct routine in their life, and suddenly that's gone. So actually having a dog helps them get back into a form of routine. Improved calmness in dementia patients, and again we'll see in a little while that it certainly improves the behaviour of children as well. Increased alertness, reduced risk of heart attack, stroke and heart failure. Again, for me as an individual, I've still got to work for another 25 years, we're living longer. I'd like to think when I do retire that I'm still going to be healthy enough to enjoy my retirement. So actually again, having a dog, it's reducing my chances of being unwell when I'm older. And if I am ill, then I've got a much better chance of recovering from it. I'm not going to visit my GP so often. I'm going to take on fewer prescriptions. So what's in it for me? Hopefully it means that I can enjoy my retirement. What's in it from a local authority point of view? I'm not, again, going to be such a great draw on the health service. So again, we're just reducing costs all of the time, just by this very simple act. Social benefits, providing structure for the day. If we've got somebody who is used to taking the dog out, feeding the dog, they're more likely to remember to feed themselves. So again, it's just giving that structure. Good social interactions, lower chance of loneliness, and promoting independence. I love my parents dearly, but having left home 20 odd years ago, I probably don't want to live with them again, and I'm sure they probably say the same about me. They're probably still scarred from me being a petulant teenager. So again, just being able to keep people in their own homes rather than in a nursing home or having to relocate. So what's in it for my children? We all want our kids to do as well as possible. Certainly dogs can help development of children with learning difficulties. It gives them more focus, makes them much more aware of the environment around them. And certainly it's been shown that they show better verbal and non-verbal interactions as well. This young lad is autistic. You can see this is his autism assistance dog. Mum's got the lead. He holds onto the dog, but he's also anchored to the dog. One of the big things with this particular young lad was that he used to bolt. So the dog's been taught that if the child bolts, he just stands still and acts as an anchor. But again, the feedback from the parents is that he's actually a much calmer child since they've had the dog. So again, just going above and beyond the call of duty, it's not just a working relationship. Children that grow up with dogs are healthier and spend more time in school. We know, particularly if they spend time with dogs, if they grow up with dogs in their first year of life, it really does help the development of their immune system. And children that have dogs spend on average 9 more days at school than children that don't. So for me as an individual, that means that hopefully if my child is spending more time at school, that they're going to get on better, that we're going to maximise their potential. For a local authority point of view, everybody has their KPIs now, and certainly having poor school attendance means a big hammer coming down. So again, I'm going to get better school attendance and ultimately hopefully get better results out of those children. There are so many more benefits with children and animals in that they have better empathy, they make friends better, they fit in better. That's what I want my child to do, is to fit in with their peers. Owning a dog will certainly help reduce the risk of allergies, so things like asthma, wheezing, eczema. If I think as an individual, it means that, again, my child is more likely to attend school and therefore do better. But if we remember things like asthma, people die of asthma. If my child has a lower chance of having asthma, then I've got a much lower chance of them having an extreme allergic response, an anaphylactic reaction, or actually dying. So for me, that's great. And again, from a local authority point of view, less pull on health resources, and it means that if the child is well, then the parents aren't going to have to take time off work to look after the child, so again, contributing to the economy. I just wanted to go back to a couple of the other points. One, dog owning adults and children are more physically active. You know, there are so many things for children to make them sedentary now. We heard about the social networking earlier on, DVDs, all these computer games and such like. When I was a child, you had a choice of 4 channels. So things have come on tremendously. So actually having a dog, again, is a good reason to get children out. If they're out, if they're more physically active, again, much lower chance of childhood obesity, which means that they're not going to have the diseases associated with it. But again, they're going to fit in with their peers. Sadly, children can be quite cruel, and a child that's obese is probably more likely to be bullied. So again, from my child's point of view, it means that they're going to fit in, they're going to be healthy, they're going to be happy. And again, from a local authority point of view, if the child is not obese or overweight, it's not going to have the associated diseases, and again, we're not going to have the healthcare costs of that. And dogs can provide great emotional support. I mentioned children earlier on, and I go back to it. This is quite a personal story, but to me, it just speaks volumes. This is my friend's daughter. This is Phoebe. I know she looks like a blonde lady, but just to prove it is actually a golden retriever. This picture was taken shortly after her father died. Sadly, he was diagnosed with leukemia, went through 6 months of treatment, was given the all clear, and within a matter of weeks, it was found to be a very aggressive form. From the day that they were told it was aggressive, he passed away 5 days later. So I was up and down the road quite a lot with them, trying to offer them support. And used to take Phoebe with me, and we used to call it Phoebe's therapy between my friend and myself. From my point of view, they didn't have a dog. The girls never spoke to me about their father's death, about his illness. But from my point of view, what's in it for me? The 2 girls are very well developed, they're well balanced, and they're great. What's in it from a local authority point of view? One could argue that there was a great opportunity there for the girls to go off the road. They haven't at all, good school attendance, good grades, and they're great, and the support they needed from outside was absolutely minimal. A lot of it was down to the way their mum handled it, but I'm fairly well convinced that Phoebe played her part as well. And in fact, to this day, when I go and visit, if they don't take Phoebe, I'm in huge amounts of trouble. And in fact, they've now gone on and got their own dog. They never had a dog before. And I think that, to me, speaks volumes of how much support dogs can give. So, that's our 10 points of the pet prescription, put in the right order. Why does it all happen? I'm not going to get too deep on you, but it's all basically because we're hardwired. This biophilia hypothesis, it means we're hardwired to appreciate life forms, to appreciate nature. Again, if we look at whether it's animals or whether it's plants, there's certainly been some studies done, for example, in prisons, where people have either had access or viewed things like fish tanks and plants, and ones where the environment has been quite barren, and the behaviour between the 2 sorts of prisoners have been quite stark. So for us in the UK, how are we applying this? Well, we've got some guidelines, so getting your daily dose, rehoming a dog, volunteering at centres, walking dogs, fostering dogs, going on to sponsoring dogs, encouraging care homes to look at having regular canine visitors. This is quite a big one we're involved with. We're working with Harefield Hospital, which is one of the key hospitals in the UK, for heart disease, heart transplants. And we're working with them to help rehabilitate some of their patients once they've been through surgery, so they come down to our Harefield Rehoming Centre and spend time with the dogs. Now again, for a lot of you, I appreciate that these are, in a completely different sphere for you. But I would certainly suggest these two that I've highlighted may be something that you might be able to look forward to in the future. But I think the important thing is the key points is to develop your own conclusions from the pet prescription. The facts are there, but I think if you can use the underlying principles, but use it in the right currency, whatever strikes a chord with the people you're dealing with. If it's the health department, then the benefits to people's health. If it's the man who holds the purse strings, then actually it's the cost benefit. But I think hopefully by using this information, it may just give you another tool in your armoury to start convincing people to perhaps view dogs in a different way and how we actually deal with them. And hopefully convert the unconverted.